All right, today we're doing something a little different. We're going to go on a mission deep inside the human body. Our target? A really powerful medication called Torsemide. We're going to follow just one dose as it goes to work fixing a dangerous imbalance that can overwhelm our most vital organs.
You know, every single day, your body is performing this incredible balancing act. It's constantly managing the water and salt levels that keep your cells, your organs, your entire system running just right. It's a nonstop, silent process that is absolutely essential for life. But what happens when that super delicate balance gets thrown off? Well, when conditions like heart failure or kidney disease or even liver problems crop up, the body can start to hold on to way too much fluid. The whole system just gets overwhelmed. And this fluid overload, it has a name, edema. It's that puffy, uncomfortable, and often dangerous swelling you might see in the legs, the ankles, or even deep inside the lungs. It's a huge red flag that the body is struggling and needs help fast to get back in balance. And that's exactly where our story begins. We're going to follow our subject, Torsemide, as it undertakes its mission to correct this imbalance and bring some much-needed relief. So what is this stuff, really? Well, at its core, it's a type of medication you might have heard called a water pill. But its real classification gives us a much bigger clue about its true power. See, Torsemide is what's known as a loop diuretic. And that name, it literally tells you its destination. It targets a very specific, hairpin-shaped structure deep inside the kidney called the loop of Henle. This is ground zero for our mission. Okay, let's zoom way in on that mission. Imagine we're now inside the kidney, where millions of tiny filtering units are working around the clock. Torsemide's job is to jump into this process with incredible precision. Think of its mission like a four-step tactical strike. First, it gets to the loop of Henle, the kidney's main recycling plant. Second, it blocks a very specific gate called NKCC2, which normally pulls salt back into the body. But that gate blocked, salt gets trapped. Third, and this is the absolute key, where salt goes, water follows. That trapped salt acts like a magnet, pulling all that excess water into the urine. And the final step? Flushing it all out. But Torsemide's mission has some seriously powerful side benefits. First off, by getting rid of all that fluid, it lowers your blood volume, which takes a huge strain off a struggling heart. It also weakly blocks a hormone called aldosterone, a major player in telling the body to hold on to salt. And finally, it actually helps widen your veins, which can give you almost immediate relief from symptoms like shortness of breath. It's a multi-talented drug. Okay, so we've seen the nitty-gritty, the microscopic stuff. Now let's pull the camera back out and follow the pill's entire journey through the body, from the moment it's taken to the moment it's gone. Now, one of the biggest reasons doctors like Torsemide is how predictable it is. We're talking about its bioavailability, which is just a fancy way of saying how much of the drug actually gets into your bloodstream to do its job. For Torsemide, it's a super consistent 80 to 90%. And that's huge because it means you get a reliable, expected result with every single dose, which is definitely not the case with some other diuretics. And check this out, Torsemide also has a really clever exit strategy. Unlike some drugs that put all their eggs in one basket and rely only on the kidneys, this one is cleared out through two different routes. About 75% is broken down by the liver, and the other 25% is taken care of by the kidneys. This dual pathway is a major advantage, making it a much safer option for patients who might have issues with either of those organs. So with this powerful and, really predictable profile, who are the people who need Torsemide's help the most? Well, its number one job is tackling that severe fluid overload, the edema, that comes with congestive heart failure. But it's also absolutely critical for patients with chronic kidney failure and liver cirrhosis who are retaining fluid. And while it's not usually the first choice for it, it can also be used to help treat high blood pressure. But of course, a medication this powerful doesn't come without some risks. In fact, its greatest strength is also the source of its potential side effects. The mission to flush out all that fluid has consequences that we really need to understand. Okay, so because it's just so good at its job, getting rid of salt and water, the biggest thing to watch out for is electrolyte imbalances, especially low potassium. If you push out too much fluid, you can also run into dehydration and low blood pressure. Other effects can include a rise in blood sugar and uric acid levels. And at very high doses, it can even cause hearing issues, something called ototoxicity. This is exactly why patients need regular checkups and blood tests. And this is a really, really important one.
It's vital to know what not to take with it. You know those common over-the-counter pain relievers, NSAIDs? Things like ibuprofen? Yeah, those can actually fight against torsemide, making it less effective. This is a crucial piece of information for any patient on this medication.
And then there are two absolute no-go situations. If a patient is not producing any urine at all, a condition called anuria, well, this drug just can't work, so it shouldn't be used. And, of course, it's not for anyone who has a known allergy to it. So, all of this brings us to a really key question for doctors. I mean, in a world with other loop diuretics, why choose torsemide? Let's put it head-to-head with its most common alternative, a drug called furosemide.
And when you put them side by side, the advantages really pop. Look at bioavailability. Torsemide is consistent and reliable, right? That 80 to 90%. Furosemide, it's all over the place, anywhere from 10 to 100%. Totally unpredictable. Then you've got how long it lasts. Torsemide has a longer action, which usually means a convenient once-a-day dose. When you add in that dual exit strategy and that extra aldosterone blocking benefit, you're looking at a profile that gives doctors and patients way more predictability and control. So, at the end of the day, what have we learned? Torsemide is an elegant, incredibly powerful, and remarkably predictable tool in the fight against fluid overload. But that very power is exactly why its mission has to be guided carefully by medical professionals who know how to manage its effects.
And you know, the journey of this one little pill kind of leaves us with a much bigger question, doesn't it? It's a perfect example of the incredible power of modern medicine, but it's also a huge reminder of the delicate systems it's working on. So, as our medical tools get even more powerful, how do we make sure we're always respecting that intricate biological balance we're trying so hard to restore?